posterior sternal end is oval and concave for articulation with its costal cartilage. The posterior end or vertebral end is made up of the following parts. Number 1, the head. Here is the head of a rib, or here is the head of a typical rib. The head has two facets that are separated by a crest. So you can see here there is a crest that divided the head to the upper and lower. The lower, larger facet articulates with the body of the numerically corresponding vertebrate, while the upper, smaller facet articulates with the next higher vertebrate. That is very important to remember and keep in mind that head of a typical rib articulate with two vertebrae, upper and lower one. The neck lies in the front of the transverse process of its own vertebrae. So the neck has a two surface, anterior and posterior, and two borders, superior, here is a superior, and inferior borders. And you can see here the posterior surface of a rib, neck of a rib, and superior and inferior borders. The anterior surface of the neck is smooth. The posterior, you can see here, the posterior surface is round. The superior border or crest of the neck is thin, and the inferior border is rounded. So it is important to keep in mind that the superior border of the neck of the rib is crest of the neck. It's very important. Another part of a typical rib is tubercle. So after the head we have a neck, and after neck we have a structure. Here it's a tubercle. The tubercle is placed on the outer surface of the rib at the junction of the neck and shaft. Here is a neck and here is a shaft. At the junction of the neck and shaft we have a tubercle. Its medial part here, its medial part of the tubercle, its medial part is articular and forms the costotransverse joint with the transverse process of the corresponding vertebrae. The lateral part that's here and is smaller, the lateral part is non-articular. So the articular part and non-articular part of the tubercle is very important, and you should keep in mind that, so it's very important. The shaft or body of a rib is flattened, so it has two surfaces, outer surface and inner surface, or lateral surface or medial surface. As you can see here in this picture, the outer and inner and two borders, upper and lower. So we have the upper border and the lower border. The shaft is curved with its convexity outwards. It is bent at the angle. So we, as you can see here, we have an angle here, and the body of the or shaft of the rib, it's bent at the angle which is situated about 5 centimeter lateral to the tubercle. Here's a tubercle, and 5 centimeter out of the tubercle we have a bend of the rib that's called angle of the rib. The shaft of the body, as I said before, has two surfaces, outer surface and inner surface. The outer surface, the angle is marked by an oblique line on the outer surface directed downwards and laterally. The inner surface is smooth, as I said, and covered by the pleura. So this surface is marked by a ridge which is continuous behind with the lower border of the neck. Here is the lower border of the neck, and continue of the lower border of the neck is a lower border or costal groove. The costal groove lies between this ridge, and the inferior border. The costal groove contains, it is very important, listen, the costal groove here, the costal groove that's continue from the posterior to the anterior, and it differs from the typical ribs. The costal groove contains the posterior intercostal vessels and intercostal nerve. Another point about the shaft of the rib is the upper border. The upper border is thick and has outer and inner lips. These lips are a place to attachment of the muscles, intercostal muscles between upper and lower ribs. So the upper border of the ribs has two lips, outer and inner lips. So in this slide I'm going to talk about attachments and articulations of a typical rib. We have two pictures here, in the right side and in the left side. In the right side we have two vertebrae with three intervertebral discs that in a blue one or blue color. The vertebrae has two transverse process, and we can see two ribs, two vertebral end of the ribs that articulate with the vertebrae. And we have a structure in a green color that's our ligaments. In the left side we have a one vertebrae and vertebral end of a rib that attach to the body of the vertebrae and attach indirectly to the transverse process of a rib. So about a rib we have a body, we have a two process, transverse process, and a single backward process. It's called spinous process. So we have a spinous process here and two transverse process, and between the body and arc here we have a foramen. It's a vertebral foramen. So about attachments and articulations of a typical ribs, there are many points, and I'm going to talk about these points that are very important to me and you. The number one is anteriorly in the right picture. Anteriorly, the head of a rib provide attachment to the radiate ligaments. We have a radiate ligament in green color here, radiate ligament. The radiate ligament has three parts, upper, lower, and middle band. And it's related to the sympathetic chain and to the costal pleura. The crest of the head, do you remember where was the crest? The crest of the head provides attachment to the intra-articular ligaments of costovertebral joint. About attachment of the neck, so we have a head of the rib, neck of a rib, and the body of the rib. Here is a tubercle of a rib, neck of a rib, and head of a rib. So head of a rib attached to the body of a vertebra through by radiate ligaments. Now I'm going to talk about attachment of the neck cover rib. Attachments to the neck. The anterior